Thank you so much, Allison. I'm always honored to join you and the Penn Memory Center. So thank you so much for having me back. I'm also really excited to talk about this topic today. It probably is the number one reason I receive referrals is for challenges with bathing, resisting bathing, refusing bathing. So I'm excited to jump into this topic with all of you today. We're going to lay some groundwork. Then we're going to spend some time really diving into common triggers. Why does resisting bathing occur? And then we're going to talk through strategies. I'm going to use some case examples from my practice, de-identified, of course, so that we can work through some situations that have occurred in real life and some strategies we've used to try to address it. Okay, so a little bit about me. I know Allison gave me a very kind introduction, but I always like to share that on a personal note, I am very passionate about this topic, both professionally and personally. So these are the Day sisters. They are the reasons I named my practice Day by Day Home Therapy and now Day by Day Dementia Consulting. That's my great aunt Jerry Day on the left, my mum Norma Day in the center, and my great aunt Doris Day on the right. All three of these ladies did pass away with dementia, but I really saw firsthand what it looked like when our family was caring for them living with dementia, both in their homes and in memory care and assisted living facilities. Okay, so I would love to get to know you a little bit as well. So I know Allison mentioned the chat. If you feel comfortable using the chat, again, that will just go to Allison and myself. I would love to know a little bit about you in terms of what do you hope to learn today? I know we're talking about bathing, but I'd love to know if there are any specifics that you hope to gain from today's presentation, and I will do my very best to address them throughout. So, excuse me, please feel free to put that in the chat as I'm talking. All right, today's presentation will explore common reasons why individuals living with dementia may resist bathing. And again, we're going to address strategies to reduce this challenge. I will use some case examples, de-identified and with some details changed. Okay, if you've ever seen me speak before, if you've ever heard me talk about any dementia-related behavior, you know that I definitely spend time on understanding why behaviors occur. So we are going to take some time laying a little bit of groundwork in terms of understanding behavior and cognitive level, and then that way we can apply that to everything we talk about today. If you do have any questions throughout, please let me know in the chat and I'll do my best to address. Okay, and thank you for those of you who are giving me feedback in the chat about what you hope to learn today. Okay, so the first thing I'm going to talk about here is the triadic model. Again, if you've ever heard me speak about behavior, this should sound somewhat familiar because I apply this to all dementia-related behavior. Today, we're going to apply this model specifically to challenges with bathing. So in this model, this triadic model, this says that we have a behavior, that light blue box in the middle. So again, that's going to be resisting bathing in this case. And then we have these three categories of possible triggers or causes of behavior. The first, the top, being the person living with dementia. So what is going on within them that could possibly trigger resistance? I'm going to give you lots of examples soon, so bear with me. We also want to think about the caregiver or the care partner. So many times that's family members, that's probably many of you. It's also formal caregivers, it's paid caregivers, non-medical home care, it's staff at adult day programs if they're assisting with bathing, it's staff at skilled nursing facilities and memory care. How is the caregiver possibly triggering behavior? And this isn't associated with blame. I'm not here to blame anyone. Sometimes our communication style, our tone of voice, the way we do or don't break down tasks can trigger behavior as well. So we're going to talk through that. And then also the environment. The environment is an important consideration for any behavior, but it's crucial for us to consider with bathing. The physical and social, but the physical environment plays such a substantial role in whether or not someone resists bathing. So again, we're going to talk through many common triggers that are housed in all three of these categories, and then we're going to talk later about how to break them down. And then thank you again for everyone who continues to give me some information in the chat. This is all helpful. Okay, and I do also want to talk briefly about this Allen's cognitive model or Allen's cognitive levels. This is not something that I expect you to learn entirely in one slide or 1 minute of me talking. It's something that occupational therapists spend many classes on. So I'm just going to review this quickly and try to break this down so that it's applicable to what we're talking about today. So in this model, we have 6 different levels. A 6.0 would be most of us on a really good day, when we're not tired and when we're not stressed. The 5 range, this would be someone who has more of a mild cognitive impairment. These are my clients who they're still safe to live at home alone, but they need assistance with really complex tasks. Maybe things like managing their finances, managing a dinner party is usually an example that I give. Things that are really complex require a lot of different cognitive skills. That might be a bit challenging for someone at this level 5 range. We're going to focus today talking a lot about clients who fall into this level 4 or level 3 range, because this is where the majority of my clients fall. It's where people with anywhere from mild to severe dementia fall in terms of this scale. So a level 4, these are clients who are goal directed. It means that they understand the end goal, or the end product, if you will, the end goal of a task. I usually use the example of brushing teeth, so I'll use that one, and then I'm going to apply this to bathing. So brushing teeth, somebody at a level 4, they understand that the goal of brushing teeth is that our teeth are going to get clean. So they can brush, and they brush the left, they brush the right, they brush the top, the bottom, the front, the back. And when their teeth are clean, they stop brushing because they understand that the goal is clean teeth. Somebody at a level 3 or a manual action stage, this would be more moderate or severe dementia, they can still participate in brushing teeth, but they're going to participate in a repetitive and manual way without that end goal that their teeth are totally clean, right? So these are our clients or family members who they'll brush, but we're going to have to cue them like, okay, now we've got to get the other side. Now we've got to get the top. Now we've got to get the bottom. And it's possible that if they stop, they're stopping before their teeth are totally clean. Or they're cleaning one side of their mouth really, really well because they just kind of keep going even after those teeth are clean, right? So they're not stopping the task when the goal is completed because they're not understanding the goal-directed aspect of things. Does that make sense? Hopefully I'm articulating that. Okay. All right. So I'm going to keep going down the levels, and then I'm going to jump back and we'll apply this to bathing. Okay, so level 2, brushing teeth. Level 2, these are our clients who are really sensory oriented. So if we think about clients who are sensory oriented, they're not necessarily engaging in a repetitive manual way. So brushing might be a little too complex for them. But these are often our clients or family members who are biting down on the toothbrush when we help put the toothbrush in their mouth. Or maybe they're kind of sucking the water off of the bristles or sucking the toothpaste off of the toothbrush. They're engaging in the task, but in a sensory-oriented manner. Okay. And then we have level 1, which is automatic actions. This would be very severe dementia or end stage. These are our clients who are typically responding more to painful stimuli. Okay. So they're going to need total assistance for something like brushing their teeth. Okay. All right, so I'm going to take bathing, and now we're going to go back up to this level 4 of goal-directed and bathing. It's possible that someone at a level 4, they're still going to need some strategies, which we'll talk about later, to possibly get them started in a task. But they understand that the goal of bathing is to get clean. They are going to be able to wash their body, even parts of their body that they can't see, in order to achieve that end goal of getting clean. Family members or clients who are functioning at a level 3 range with bathing, they're able to engage in parts of the bathing task, but they're not thinking about that end goal of getting clean, right? So they can take a washcloth and they can, repetitive and manual, rub that washcloth on their arms. Maybe we cue them to wash their legs, so they can do it repetitively and manually, but they're not thinking about the end goal is that they're totally clean. It's also really important to note that at a level 3, individuals are really not able to attend to what they can't see. So if it's not in their visual field, it's going to be really hard for them to engage with it, meaning that they're likely not going to wash their back, their bottom, even sometimes their feet or their hair, because those aren't parts of them that they're necessarily looking at. Unless they bend down or twist, if they're not looking at that part of them, they're not going to engage with it. So I say that because it's important for us to be able to provide an appropriate level of care and level of support at that stage. And I know you're all here because you want to know, how do we support someone when they're resisting that support? And I promise we're going to get into that. Okay, does this model make some sense? Can we see how we can use this to help us understand bathing and function? Hopefully doing okay. I see like a couple head nods. Thanks for some info in the chat. Okay, great. All right, so now let's chat about resistance. That's why we're all here today. So resisting care, this has lots of different terms. We can say resisting care, we can say resistant behavior, we can say rejection of care, resistiveness to care, care resistant behavior, resistance to care, refusing care. We're talking about the same thing with all of these terms. I just want you to know there's lots of different terms out there for this topic. For anyone who maybe dives into any research, these are all different terms you'll find in the research. You'll also see refusals as well. All right, and just to define this so we're on the same page, refusing care can take a lot of different, it can look different in all different clients. So it can take a lot of different forms. Refusing or rejecting care may take various forms. A person with dementia may become agitated and resist help with daily activities by pulling away, leaving the area, crying or loud exclamations, verbal and physical aggression, such as cursing, biting, grabbing, pushing, or threatening. We also know from research that more time is required to actually physically assist people with moderate Alzheimer's disease with bathing than people with advanced Alzheimer's disease. And again, I know that that particular quote applies just to Alzheimer's disease, but I believe that that's true of multiple types of dementia. So it's typically takes us a little longer to physically assist people with moderate dementia with bathing than people with advanced dementia, because it typically takes longer to guide people with moderate dementia or Alzheimer's disease to the bathroom. Okay, so again, I mentioned a couple of these, but just to be thorough, resistance to bathing may include pulling away from the caregiver, tightening limbs. Some of you may be experiencing that where your family member their arms get really tight and close to their body so you can't clean under their arms, or crossing their legs really, really tight so you're not able to provide hygiene and clean between their legs. It could also be waving their limbs, so kind of almost like pushing you away, or verbally objecting to care with words or noise. Great. Okay. And I think it's also important to note that we say refusing or resisting care, but agitation and agitated behaviors often go hand in hand with refusing or resisting bathing. So we can see, again, verbal aggression, physical aggression, and also what we would call non-verbal non-aggression and physical non-aggression. So negative comments, complaining, restlessness, inappropriate disrobing, things like that. Okay. And I'm just keeping an eye on the chat. I appreciate anything you're all sharing with me. Yeah, meeting them where they're at, really important. I appreciate that. Okay, so now we're going to talk triggers specifically for resisting bathing. So again, I had mentioned that triadic model, right? So we have our 3 categories. We have what's happening within the person living with dementia. We have what the care partner or caregiver is doing or saying, and that could be family caregivers. And it's also the physical environment. So let's dive into common triggers for resisting bathing. So if we think about what's happening within the person living with dementia, one of the most common triggers for resistance or refusal in general, so that could be bathing, refusing help during toileting, refusing help during dressing, refusing taking medications, refusing drinking. One of the most common triggers is a sense of loss of control from the person living with dementia. If that person feels as though they are losing control or don't have total control, one of the responses is resistance. I often use the example of if we offer a yes or no question to someone living with dementia, what's the most common answer that we get? It's usually no, right? And so my theory behind that is it maintains control, right? If I'm not 100% sure what someone's asking me, or I'm a bit confused about the situation or the details, and someone asks me a yes or no question, I'm going to say no. Because if I say no, I maintain control. I am not agreeing to something I don't understand. I'm not saying yes to something I'm confused about. So saying no or refusing or resisting can be a manifestation of loss of sense of control. Okay, so I just want you to keep that in mind and think about if that applies to your family member or your client. Okay. Again, if you've seen me speak before, you'll also know it's rarely just one trigger. We're usually working with a whole combination of different things that are happening. So it's possible that someone is experiencing a sense of loss of control and experiencing other factors, and maybe the caregiver communication and environment. So there may be multiple triggers contributing to resistance. All right, so in addition to a sense of loss of control, we also want to consider if the person living with dementia is afraid. Are they fearful for whatever reason of the shower, the bathroom? This could be that they're afraid of the bathroom itself. Maybe the bathroom's dark. Maybe the shower stall is really dark. Maybe they're afraid of falling, and so the transfer into the shower is scary. And again, they could be afraid, but they're probably not articulating that. They're not saying to us, hey, I'm resisting because I'm afraid of getting a shower, right? So we have to be detectives and try to figure out if that fear is contributing to resistance. We also want to consider if the person living with dementia is unsure of what's being asked. They're confused about exactly what they're supposed to do. It's also possible that the person living with dementia is perceiving the water as painful. So with any progressive neurological condition, we know that our systems change, right? The way that we perceive things can change. Sometimes, I'm sure you might notice with some of your family members or clients that sometimes even light touch, like if we accidentally just brush past someone, sometimes they kind of almost jump, right? Sometimes they perceive light touch as painful. And that can be true of water coming down from a shower head as well. This doesn't apply to every single person with dementia, but we want to be perceptive to figure out, is this person actually perceiving the water itself as painful? It's also possible they're experiencing an invasion of privacy and personal space. Maybe there's someone who, has always bathed or showered independently. They've never really had someone else in the bathroom with them. The idea of being exposed or naked in front of another person feels uncomfortable. So we want to consider that as well. Also, are they cold? This is a really common trigger. Or are they feeling overstimulated? There's a whole lot going on in their environment. They're feeling a bit overwhelmed by everything. And so therefore they can be resistant. Okay. Oops. All right. So now we're going to think through what are the triggers to care partner communication and management. Okay, so when we think about how the care partner is communicating or managing a particular task, it could be that, again, no blame, but it could be that they are actually triggering the resistance. So one thing I want you to think about when you think about the resistance of your family member, when is the resistance starting? Is the resistance starting once you're already in the bathroom and you turn the water on? Is the resistance starting when you say, it's time to get a shower? Is the resistance starting when you start to help them remove their clothing? The start of the resistance is going to tell us a lot about what the trigger may be, or at least one of the triggers, right? So, for example, if you say something like, time to get a shower, and the person immediately says, no, I'm not doing that. Or they're saying, oh, I already took a shower this morning. I don't need to do that, right? That gives us some indication that even just the word shower, or even maybe saying getting washed up, maybe just those phrases are some form of a trigger in and of themselves. So we want to be really thoughtful about, is it what we're saying that starts to trigger the resistance? We also want to consider our tone of voice. Is our tone of voice harsh? Did we change up the bathing routine? Meaning that this person, maybe they always used to take a bubble bath before they went to bed at night. And now we're trying to encourage them to take a shower bright and early every morning, right? That's a big shift to what's been their routine all of their life. So we want to take that into consideration. We also want to think about, are we rushing the person with dementia? And what are our expectations? Are we expecting that the person with dementia is going to be able to initiate and bathe independently? Maybe it's the opposite. Maybe we're assuming that the person living with dementia really can't participate in bathing at all. And so we're trying to do 100% of it without their participation. So involving them, but in an appropriate amount is important. Okay, and then environment. So some common triggers to resistance to bathing include overstimulation, meaning that there are multiple people in the bathroom with them, maybe a couple different people trying to take their clothing off at the same time, maybe the TV is on in the background, maybe someone's having a conversation outside the bathroom, or the room is too cold. I can't tell you how often a cold bathroom contributes to resisting bathing. I usually tell my clients when I'm working on resisting bathing, if I'm not sweating, the room's not warm enough. So usually we want the room to be really, really warm. This might be that and I'll talk about strategies in a bit, but one common way to do that is to run the water ahead of time for a little while, get the bathroom kind of steamy. And then we bring someone into the bathroom. But I know I jumped ahead to strategies. Yeah. And I should say, not only do we consider temperature from the aspect of just, being cold is uncomfortable, but also many times people living with dementia are older adults, not always, but many times. And as we age, our skin gets thinner, right? And as our skin gets thinner, more heat escapes from our body. So we really, especially if we are, a slightly younger caregiver or care partner, we want to consider that individual is likely not feeling as warm as we are if we have thicker skin, right? Literally thicker skin. So we definitely want to take that into consideration. Okay, everyone's still with me on what some of the common triggers are for bathing? All right. So why is this something we talk about? Again, since you're all here, I think you all can appreciate why this is something that we're addressing. But usually this is something that we talk about because risk of skin breakdown, right? Hygiene. We want to make sure that the person's skin is clean so that we don't have skin breakdown, and we want to prevent infections, especially urinary tract infections. Those are kind of two big hygiene or health reasons why we focus on bathing. And then also it's often really distressing to caregivers or care partners when they're experiencing this resistance regularly. Okay. So now we're going to shift gears a little bit into some case examples. Some of these examples, the way I frame them, might sound a bit clinical, but I'm going to try to give you some context around them so we can see them as whole people, whole individuals. And then I am going to have you all participate in the chat as much as you're comfortable with. When I jump into these case examples, we're going to explore together what are some of the triggers we think are going on, what's causing the resistance. And then we're also going to talk about strategies. So I'm going to open it up to hear what all of you have to say about strategies, and then I'll share with you what we were actually able to do. All right, so here's one case example. I was working with, we're going to say, a 74-year-old female, primarily being cared for by her husband and non-medical home care. She had unspecified dementia, and her Allen's level was consistent with a lower 3. So again, manual actions, but also kind of easing in closer to the 2 range where we're sensory oriented as well. Okay. All right, so a description of the behavior. What did this resistance look like? The client would prevent her husband from doffing or taking her clothing off. When her clothing was off, the client would yell and push him away. And when he tried to support her, and she would do that when he was trying to support her getting into the tub and shower as well. Okay, and then additional information. This client did have a formal care partner, meaning they had a paid caregiver who was with them Monday through Friday morning. And I was able to observe the morning routine between the husband and wife. So a little bit about what that looked like. So the husband would go into the room in the morning. He would turn the lights on in the bedroom, pull the covers off of the client, lift his wife to sitting on the edge of the bed. He would pull his wife up to standing, walk her to the bathroom, pull the nightgown off over her head. And then that particular moment is really where we saw the resistance and agitation escalate. Some additional information that's helpful to know: there were grab bars in the shower. There was also a shower chair in the shower. And right after bathing, this wife would be kind of ushered into breakfast, but she really wasn't participating in eating breakfast, which was also one of their concerns. So if we think about this case as a whole, What do you think? And again, we're just making some educated guesses here. Go ahead and put in the chat, what do you think are some possible triggers as to why this woman was resisting bathing and getting agitated when her husband was trying to take her clothing off? I'm seeing overstimulation. Absolutely, I would agree with that. Too abrupt a change. Yes, I would agree with that as well. Waking up that way would agitate me. I say that all the time. Possibly that she's being rushed. Yes, she wasn't ready. Pulling the gown over her head. These are all fantastic answers. You can keep them coming if you want to. Absolutely, right? So if we kind of put ourselves in her shoes for a minute, if I am in bed and sound asleep and nice and cozy warm in my bed, and someone comes into my room, turns the lights on, pulls my covers off, sits me on the edge of the bed, walks me to the bathroom, and immediately tries to get me undressed, I'm going to be agitated too. I would honestly probably be physically aggressive before we even get to the bathroom, right? So the rushing part of this, or at least the abrupt changes, absolutely are a factor in why her resistance is occurring. I'm also seeing in the chat some additional input as well of not being asked, not feeling a part of the process. Yes, a sense of loss of control, right? She really didn't have any control and really wasn't able to participate in any of these tasks, not being told what's happening. Also, probably cold, right? She was nice and cozy, warm in her blankets, pulled those off immediately in this bathroom. She's probably cold. Yeah. What else do we think? Is there anything else we didn't talk about? Anything else you think is happening? So what's going on within her? She's confused about exactly what's happening. She possibly is feeling overstimulated. Absolutely, it's possible that she's experiencing pain or discomfort. We haven't really talked about that yet, right? Maybe she has some underlying discomfort. She hasn't even had her medication yet this morning. She's feeling cold. Then we have the care partner. Again, I'm not blaming or shaming anyone. This is hard work that everyone is doing. But this particular caregiver, maybe he was feeling really stressed. So that's why he was rushing through the motions. He was a bit abrupt, as someone put it, in his support of getting her up, awake, into the bathroom. And then when we think about the physical environment, the abrupt change in lighting, that can be startling. The change in temperature, those are really important factors to consider. Yeah. All right. So now that we have some idea of what some of the triggers might be, what are some strategies we could try for this client? So I'm going to have you put in some things that you think we could do, and then I'll tell you what we did for this particular client that was effective. I'll give you a few minutes to put some things in the chat. So anytime we come up with strategies, we often want to connect it back to the why, right? So if we know, for example, that one of the triggers is that she's feeling cold, then we're going to have a strategy be temperature. We're going to increase the temperature, right? Okay, so I'm seeing possibly taking a bath after breakfast. Love that. Also, oh yeah, nope, I agree, and no worries, Allison. And I think that thinking about the routine is an important component here, right? Can we shift things up? I would wait and see when she usually wakes up, nor does she have to be bathed every day. Yes. Have everything ready in the bathroom. Maybe she should bathe later. Yes. Get up more gradually, wake client up, but not get her out of bed for a few minutes. Oh, these are all such great answers. I'm going to say we did some combination of most of what you're talking about. Sometimes simply the sound of water. Yes. It's being too hot. It's being too heavy or too loud can be a trigger. Absolutely. Or it could potentially be the other way, where sometimes the sound of water can actually help facilitate the task, but we have to be careful about if it's a trigger or if it's helping. Absolutely. Okay, so for this particular client, we did a combination of a lot of the things that you all are suggesting. So we said, okay, we are going to go into the room, crack the blinds open just a bit, let a little bit of natural light come in, leave the room. She usually ate oatmeal, so then we would make the oatmeal, have the nice, lovely smell of oatmeal kind of go through the house, bring the oatmeal up to her in the bedroom, gently wake her, encourage her to sit on the edge of the bed, but she can keep that blanket wrapped around her, right? We don't need to immediately rip it off. So she can have her cozy blanket around her. She's sitting on the edge of the bed. We have this delicious smelling oatmeal. So we have our breakfast in bed. She eats the oatmeal and she eats much more of it because we're prioritizing that task, right? So we're shifting up the routine. And then once she sits there, I think she had a cozy chair in her room. So after she would eat her breakfast, she would kind of move over to the chair, sit and relax for a little bit, either listen to some music or watch a relaxing television program. After she had some time to digest and wake up, gently walk her into the bathroom. I am a big fan of, if we have a dryer in the home, anytime before a shower or bath, we have a whole load of towels going in the dryer. So we can just pull out nice warm towels anytime we need to. So because she was wearing like a nice big flowy nightgown, we were actually able to wrap warm towels around her under the nightgown. That way, when we went to remove the nightgown, she's still wrapped up in a nice, cozy, warm towel, right? So that temperature shock isn't going to be as drastic. If someone isn't wearing something that loose, we can still assist them with removing the piece of clothing and kind of immediately wrap them in a warm towel or a warm robe. And it's absolutely reasonable for individuals to wear those warm towels or warm robes into the shower, right? Okay. And then once she was in the shower, then we were able to go through the motions without any issues. So for her, there was a big emphasis on adjusting routine, decreasing the rushing, prioritizing her getting some food in her system and relaxing a bit when she woke up, and keeping her warm. Okay. Any questions about this particular case? I have more examples coming up because I know that this does not describe everyone's family member. All right. The other thing we talked about in this particular case was this concept of relax the rules. So I think someone mentioned this in the chat, which is, as long as hygiene is not something that we're overly concerned about, meaning she's not having bowel incontinence, that we're feeling like she has to get a full shower every day, she probably doesn't need a shower every day. It's also perfectly reasonable, which I'll talk about with another case example, to talk about a sponge bath. If that's something that's more comfortable for the individual and is easier for the caregiver, then that's fine as well. My rule is usually, is my client, the person living with dementia, are they happy, healthy, and safe? And by healthy, I also mean hygiene as well, right? Happy, healthy, safe. If we achieve that with a sponge bath, I'm okay with that. So we can consider that as a very reasonable option. Okay. And also for this client, we talked about this idea of respite. If you have a caregiver who's helping you out Monday through Friday morning, it's okay to use them to your advantage, right? We can absolutely have them assist with the bathing while the husband does breakfast prep, as opposed to the other way around. It's also possible that maybe the husband being so stressed that maybe the person living with dementia is actually a little less resistant with the caregiver because that paid caregiver isn't as stressed. So they might have a different tone or different body language. Okay. All right, we're going to talk about case example number 2. this client we're saying is a 75-year-old female being cared for by her husband. She had Parkinson's disease and dementia. And again, Allen's level, lower 3, so manual actions. And then when we think about what is the behavior, the husband, who was the primary caregiver, he would say, do you want to get a shower? Or he would say, time to get a shower. And the person living with dementia, his wife, would say, nope, I already showered today, or not now, I'll do it later. Anybody in the audience fall into this category? I'm guessing maybe a few people have experienced this. Yeah, a few people are saying yes. Yeah. Yes, yes. And I appreciate, I'm seeing that, absolutely. And I'm seeing the comments about people living with dementia pick up on facial cues. Absolutely. Our tone of voice, our body language, our facial expression all have a very significant impact, on the behavior, positive or challenging, of people living with dementia. Yeah. Thanks for sharing, everyone. Okay. Additional information about this client. This client was previously an interior designer. She lived in a single-story condo. She had a shower chair. She enjoyed time at the beach. She had 3 children. One of her children was local. Oops, sorry, jumping ahead. So I know you don't have a ton of information here, but if you had to make some guesses, what do you think might be some triggers of her behavior here? So again, the husband saying, do you want to get a shower, or time to get a shower? And his wife would say, no, or I already showered today, or I'll do it later. Go ahead and put that in the chat if you have any ideas. So the first thing I do want to highlight is that, sometimes I was just doing a workshop yesterday where somebody was suggesting that the person with dementia knew they didn't shower in the morning, but they were essentially making it up and lying to get out of taking a shower. I do not think that that's the case, right? The person living with dementia, if they're saying something like, I showered this morning, they likely truly believe that they did shower in the morning. So we're not going to assume that the person living with dementia is going to try to manipulate us. Manipulation, spite, all of those types of things, those are high-level cognitive processes, right? So people living with dementia, especially moderate or severe dementia, they are not going to be manipulating us, or they're not going to be spiteful. That's a very complex cognitive skill. Okay. So some of the things that we're going to consider, yes, I'm seeing someone hit the nail on the head with a really big one here. Sense of loss of control. Absolutely. It's also very likely that she didn't totally understand the request. Somebody's also saying, does she even need to shower? Yes, the husband could rephrase his request, or just say something like, okay, we'll do this later. The anticipation of a shower can be unpleasant for a client. Absolutely. That anticipation of something that could be scary or upsetting or anxiety producing absolutely could trigger refusal or resistance. Yes, and I appreciate that comment about this behavior. It's the disease talking. It's not the person, right? It's not the person trying to be difficult. We're going to try to get that out of our head. And I do think it can be really helpful if we can almost reframe it in our mind. If we hear our family member saying something like, no, I'm not going to do this, and think about it as, it's the dementia that's being difficult. It's the dementia that's speaking to me. It's not my family member, right? Yeah, I think that can make a really big difference. And then I appreciate the comment here as well that the word shower could be a trigger. So no forewarning could complicate things, no control. Yeah, this is a really interesting line that we have to try to walk. We have to try to figure out, how do we allow the person living with dementia to feel in control, but not give them too much information where we're triggering anxiety or exacerbating the resistance, right? And so that's where things get really nuanced. We have to be very creative about how to make that happen. I think everything you all said, spot on, absolutely appropriate. So now that we have an idea of triggers, what do you think are some strategies for this husband? What could we try differently here? So somebody said, maybe she doesn't have to get a shower. That's definitely on the table. Maybe we don't need to make that happen today. But in the event that this is happening every day, or he says, okay, no big deal, we'll do it later. And then he goes back later and he says, okay, you said later, now it's time to get a shower. And she says, oh no, not now. We do need some sort of strategy that we're going to be able to implement if she's experiencing resistance every time. Somebody said distraction. Love that. So distract her with something else. I love that. I would also love if anybody has any creative ideas about what distraction would look like for this client. And again, I'll share with you in a minute what we ended up doing. Deflect, change topic, and then try to bring it back. Love that too. So it could be that we just kind of go along with her. You know, she says no, or I already showered today. We say, okay, we let it go for a while, and then we circle back to the conversation. That's absolutely a reasonable approach. And again, I also want to say we can do that, and it's possible that we do that and we come back to the conversation and the answer is still no, I'm not showering. So we do want to have some backup options. But again, I really appreciate that so many of you understand this concept of we are not going to argue with her. We're not going to try to reason with her. We're not going to rationalize, because none of that is going to be effective. I'm seeing someone who says, have the shower ready for her when you come back to the topic. Yes, that's one of my favorites. So yes, and don't force it. So if our words are triggering the behavior, then we have to think about how can we facilitate this task without words? Can we use the environment to tell her what to do? So can we set the bathroom up? Everything's ready to go for a shower, right? And I'm just going to pause for 1 minute. Allison, did you want to jump in?
Yeah, we have a few people in the chat asking about what your thoughts are on kind of quote unquote making a deal to showers. So providing some kind of incentive, like if you shower, then you get dessert, or then you get a special meal.
That is a really interesting concept. So I am not someone who's going to argue with a strategy that's effective. So like, if you have this strategy that you're using and it's working for you, I'm not going to tell you that you can't do it. What I will say is that those types of strategies don't always work because they do involve, you know, it's essentially like bargaining with them, which is a little bit of reasoning. So they're not consistently effective strategies. But again, if it's not hurting anything and it's working for you, I'm not going to shut it down. As long as it doesn't create additional behavior and doesn't cause you additional stress, I'm okay with it. I also think it's okay to use things like, let's say I've absolutely had clients where if they think they're going out that day, they're happy to get a shower. Or if they think they're having visitors over, they're happy to get a shower. Perfectly okay for you to use a therapeutic fib or loving deception to say, I think we're going to have visitors later today. Why don't we get washed up? Right? It's okay to use those types of strategies. So yeah, great questions. Appreciate that, and keep them coming if there's any more like that. And I love, somebody asked me about aromatherapy. I think I have a slide like much later in today's presentation that talks very briefly about aromatherapy. I'm going to speak to it briefly now, but I believe I'll circle back to this again. Aromatherapy in terms of resistance to bathing. I do not believe there was substantial evidence to suggest that it necessarily was effective at reducing resistance. However, as long as it doesn't, again, exacerbate behavior, I'm not opposed to it. And there is some evidence to suggest that using lavender, the scent of lavender, can promote sleep in people living with dementia. That research was specifically conducted in a facility type setting, so skilled nursing. But I figure, okay, if it could potentially promote sleep in skilled nursing facility for people with dementia, it must have some sort of soothing benefit. So why not give it a shot in the bathroom too, right? So again, if it's not going to hurt, I'm not against it. The things that I avoid are, again, some of those communication, I don't even want to call them strategies, communication triggers, like explaining, rationalizing, reasoning, right? Those are the only things that I'm really going to say, nope, we're not going to do that, because that's going to exacerbate behavior. But any of these other things, again, even if there's not strong evidence that shows us, yes, it's effective, as long as it's not hurting the person living with dementia, it's not increasing behavior, and it's not causing you additional stress, I'm okay with it. It's actually the research, and I will talk about the research in terms of strategies. The research about dementia-related behavior is interesting in that the research shows us that the most effective strategies to manage behavior are client-centered approaches, are problem-solving approaches, which is everything we're doing right here. It's figuring out what are the individual triggers for my family member and what are the strategies that match that. There is no one size fits all. So there's limited research because they might say, hey, we're going to try aromatherapy for everyone, but that might not be a great fit for some people. Maybe not everyone loves the smell of lavender. So we just want to make sure all of our approaches are person-centered, client-centered. And again, many of you on the call, I know, are family members. You know your family members better than most. So you're going to know what their preferences are in terms of scents and possibly even when we talk about like music later, things like that. Yeah, and I love some of you are suggesting some other great things in the chat as well. This idea that we can say, we are going to take a shower. That is fantastic, especially because if we use the term we, it's implying that we're not telling someone that they have to do something. So we're reducing sense of loss of control. It's also, again, if you are spouses, I have no problem with you two taking a shower together, right? I have plenty of clients who shower together, and that significantly decreases resistance. So that's not a bad way of doing things. It's also possible we could say something like, you know, oh, I was going to get a shower, but you can go first. Right? So again, it's taking away that sense of loss of control. So, oh, it's something I was going to do too, but I want you to go first. So you're trying to be kind. So we can use those types of things sometimes. Some of these strategies are great. On the other hand, yeah, these are all great. It's possible, yes, that sometimes a smell can trigger. Yes, I appreciate that someone put that in there as well. Again, we want to be really thoughtful about our individual family members. Some people are going to be extra sensitive. So some certain scents may actually trigger agitation or resistance. Absolutely. And also somebody just put in here too about this idea of saying something like, let's get ready for the day, or it's a beautiful day outside. Let's get ready. And kind of using that to initiate the process. I love that. For this particular client, what we ended up doing is we tapped into her background as an interior designer, right? So instead of saying anything about the shower or bathing, we had the water running in the bathroom, so ready for the shower and the environment. And then we said something like, I was thinking of painting the bathroom. Can I get your opinion on which color? Do you think green or tan, right? So we could get her in the bathroom. We're reducing the sense of loss of control because we're saying, we want your opinion. And we're tapping into something that's really important to her, which is her background as an interior designer. So we can use something like that. We can also say, I want your opinion. Which hand towel should we hang up? This one or this one? Or do you like this color washcloth or this one? So we can give her some simple choice, but allow her to feel in control. Then we get her physically in the bathroom. The water's already running. And maybe that's when we say something like, oh, I was going to jump in, but you can go first, right? So we're reducing a lot of the triggers here by taking away the words that are triggering. We are taking away that sense of loss of control and capitalizing on what's important to her. Yeah, somebody is asking if that's considered a form of deflecting. Good question. I don't know that I would, I guess we could. I don't know if I would necessarily classify it typically in that way, but would I call that deflecting or redirection? I guess it could be. Yeah, I'm thinking of it more as a strategy to reduce the sense of loss of control. But let's say she is becoming, she was resistant or agitated. And then I say something like, I want your opinion on the colors for the wall. That would be, if we're kind of switching gears to try to get her away from the agitation or anxiety, that would be maybe where I would say it's a deflection or redirection, if that makes sense. Yeah. Oh, no problem. I'm seeing that comment in the chat. Happy to have you. All right. So I'm going to move on to another case example here. We have, just going to move my chat box so I can actually read my slide. We have an 82-year-old female. She's being primarily cared for by memory care staff. So her son would visit 2 to 3 times a week. She was diagnosed with Alzheimer's, but also anxiety disorder. Her Allen's level was, again, that lower 3 range. And then the difficulty here is that I was called in more in a consultant role for this one. The woman hadn't bathed in over 3 months. There's also some pacing, some verbal aggression, saying things like, go home, no one wants you here, why can't you just leave me alone? There was a shower chair and grab bars present in the shower. She did have her own bedroom, but there was a shared kind of mutual area with a kitchenette. The bathroom was shared, and she enjoyed carrying baby dolls around. So again, I didn't have the whole picture because I was kind of called in for more of like a almost crisis situation because they were really concerned that she hadn't bathed in some time. But just based on my brief encounter, I did have some guesses. So what do all of you think? What are some guesses about her resisting? Could be the shared bathroom, right? I will also say the bathroom itself in this particular memory care community felt kind of clinical, right? It didn't really feel like a comfortable home bathroom environment. I'm seeing someone who shared the strategy 100%. That's exactly what worked for this client. I'm going to circle back to that in a minute. Yes. Somebody also saying limited privacy. Maybe the staff's not properly trained. That comes up. I always say staff in care communities often are, overworked and underpaid. So they're not always given a lot of resources. And they have a lot of clients or a lot of residents that they're expected to go through morning routine, but also quickly. And so not having the strategies, not knowing that rushing can actually make everything more difficult can absolutely be playing a role here. Also, limited privacy. I can't remember if I shared that somebody said. Possibly that the son's visits are adding to anxiety, right? It could be one of 2 ways, right? It could be that his visits help to reduce anxiety because he's a familiar, comforting presence, or possibly for whatever reason, his visit is actually triggering anxiety. Absolutely worth considering that. Possibly this resident isn't comfortable in the environment. Yes, definitely. And again, I know I sound like a broken record, sense of loss of control here as well, too, right? Not feeling totally in control. Again, maybe not totally familiar environment. Yes, she's been here for 3 months, but it's still not home. So maybe not feeling totally comfortable in this shared bathroom in an environment that doesn't look totally familiar to her. So one thing that we talked about was seeing if we could adapt. Well, I shouldn't. Somebody said a strategy. I'm going to give you guys an option before I jump in. So what do you all think? Again, this is tough in a facility or community type setting, but what do you think we could do to reduce her resistance? Absolutely. Review the level of anxiety. What kinds of medications is she on? This is absolutely a crucial component of this treatment, is making sure that her medication is appropriately reviewed and adjusted as needed. And I'm seeing that strategy come up again, which is spot on. This is exactly what made the biggest difference, which was to, and a couple people are saying this now too. Yes, asking her to help bathe the baby doll, right? So if she's caring for the baby doll and carrying it around, and we want to tap into that, again, thinking about what's important to her. So if caring for children was an important part of her life, and carrying this baby doll and taking care of that is an important part of her current routine, we're going to tap into that. So, looks like the baby could really use to get washed up, or to get a bath, or to get clean, depending on what words we find don't trigger her. And that's what we were able to use. So, okay, we've got to get the baby's clothes off. Time to get our clothes off, helping her take her shirt off. Okay, we've got to get the baby wrapped up in a towel. Time to get you wrapped up in a towel. Let's step into the shower so we can give the baby a bath. So we were able to kind of step by step care for the baby and provide her with the appropriate level of assistance. A lot of it, has to do with our words, the way that we're coming at it, slowing things down, which again can be really hard in a facility when they have so many residents to care for, but trying to not rush, trying to be present with her one-on-one, talking with the physician about, are we sure that her medications are the correct dosage, or are there side effects of the medication? And also someone mentioned ruling out a urinary tract infection. Absolutely. Or other underlying conditions. Even things like, I mentioned this a lot when I talk about aggression, constipation, or the need to have a bowel movement are really common triggers for aggressive behaviors. So if someone is not typically aggressive or typically resistant during bathing, and then we have this acute or sudden change in behavior, and we're seeing resistance, we're seeing aggression, agitation, we do want to consider, one, do we need to have the medical team rule out a urinary tract infection? Two, are they experiencing some sort of discomfort? That could be from constipation, need to have a bowel movement, pain, arthritis. These are all things we want to consider. And someone saying, don't give up on them, right? If we think about behavior as a form of communication, again, they're not doing this on purpose. They're trying to communicate something to us. We just have to be the detective and try to figure out what it is that they're communicating. Yeah. The other thing I talked about with the staff here and the son was trying to figure out if we could make some subtle changes to the environment so that it didn't feel so clinical. Could we try to warm it up a bit in terms of, were there even pictures that we could hang? Or I know that it was tricky because this particular woman had some rummaging tendencies as well. So they tried to clear everything out of the environment. But if we could try to put even just a few things out so it looked like a home, even if just during the shower time when we're there to supervise, and then pack it all back up and lock it in a cabinet afterwards, at least to create a more comfortable and less clinical feeling bathroom. So those are just a few strategies for this particular woman. Again, I think that there's a lot more that needed to be done in the long term to ensure that this could be a comfortable process for her on a regular basis. But I do think that really tapping into her interests and her desire to care for that baby doll, that was really the point that helped us the most. Okay. And just checking in, I have a couple more cases that I'm going to jump into, but how are we on questions? Does anyone have any questions so far? I know I've just been kind of rolling through things. Doing okay? Okay. All right.
I have one question. I'm
Yeah.
sorry. I had to interrupt my listening because of some phone calls, and I apologize. Is this recorded at all? That I can
Yes, this will be recorded. Thank you for asking.
how can
Yes.
how can I access that?
Um, I believe that the recording will be provided to everyone.
So the
afterwards.
recording is going to be on our website within a couple of weeks. And when Rachel's presentation is over, I'll also be emailing out her slides to anyone who is registered.
Thank you so much.
Sure.
Okay.
And you can put other questions, pop them in the chat, please.
Okay.
Thanks.
Thanks, Allison. Thanks so much for checking in. Okay. Any other questions? Feel free to put them in the chat just so we can keep you all anonymous. Okay. All right. Oh, sorry. Case example number 4. So I'm going to talk about this individual who had Alzheimer's disease. She was being cared for primarily by memory care staff as well. I try to give us a range of different cases and caregivers just so we could see a couple different experiences. So she was resistant to bathing. She was a woman who was deaf, so she was yelling, and this yelling was quite loud, and it was upsetting some of the other residents. Most of the yelling started when care partners tried to remove her clothing. Some things that are important to note: that even though she's deaf, she can sign, she can read lips. She previously worked as an educator, loves dogs, and has some family that lives nearby. So what do we think might be some triggers to her resistance here? Why might she have been resistant and yelling very loudly when the staff was trying to remove her clothing before bathing? So go ahead and put that in the chat if you guys have any ideas about what triggers might be. Absolutely. So the first comment I'm seeing is not approaching her from the front so that she could see their lips. That was a huge factor here, right? Sense of loss of control absolutely is a factor. And with her being deaf, she really needed to be able to see the person, to be able to read their lips. And if we had difficulty with her understanding reading lips, or because of masking, if they weren't able to access a clear mask, having some sort of not having access to really any type of understanding of what was happening to her, that was absolutely a trigger, right? So let's say the person was masked and she wasn't able to read their lips. That could be a potential trigger as well. Anything else? We could also say, oh, yep, I'm seeing cold environment. Yes, yes, yes. Warming the bathroom with a space heater. I found a couple people who have said that in the chat as well as a strategy. Again, I'm all for that at home. I'm just very aware of safety. So as long as you're kind of doing like a space heater in the bathroom ahead of time and then taking it out just for everyone's safety, I'm all for it. Facilities are a little trickier because they're not going to allow external space heaters, but many memory cares these days have heat lamps built into the ceiling of bathrooms. Not all of them, but some of them do. So we definitely want to crank that on before we go in the bathroom. Great. But I really appreciate that last comment about temperature. So feeling cold, absolutely a factor. Yeah, I think you guys hit the really big one. Sense of loss of control, not feeling as though she could see the people providing care, not understanding what's happening to her, and not being able to read lips or understand what was going on, and being cold. Really, really big ones here. Great. So what are some strategies we can use? So definitely warming the environment. Love that one. And I think kind of implied in somebody else's comment is this idea of being able to speak to her in front of her on her level, again, so that she could read lips. If someone's wearing a mask, we had laminated cards that we made that just said things like pants down with a picture of pants and an arrow down, or shirt off. Really simple phrases with pictures associated with it so that we could show it to her before we started providing the assistance for that particular task. The other thing I found with this particular woman, and I bring this up here because I think that this is maybe an underrated strategy. So she loved to wear turtlenecks, right? So when we would pull the turtleneck off, you can imagine she's like, oh gosh, right? That's not a great feeling of someone ripping a turtleneck off over your head. So as soon as I would pull that off, I would try to make sure that my face conveyed this as well. But then I learned the sign for I'm sorry, right? So I would pull it off and then just say to her, oh, I'm sorry, because I know that wasn't comfortable for her, right? And just being able to express, oh, I'm sorry, made a huge difference in how she felt after that, taking the turtleneck off. Yes, of course, we can also talk about adaptive clothing, having looser fitting shirts for her. It was something that we kind of toyed with that idea, but she was so used to and comfortable in her tight turtlenecks for warmth that we didn't want to shift too many things at once for her. So we decided to stick with the turtlenecks and just give her a simple, I'm sorry, after taking it off her head, and we could reduce some of the agitation that way. Okay, so we talked through kind of what it looked like to get her undressed. Now that we've been able to get through that component, now we need to talk about the shower. So she was someone who used a wheelchair, so we were able to transfer her into the shower. I was a real stickler on she has to still be covered, either, again, in a robe or warm towels. We cannot have this small woman who is always cold regardless of the situation being transferred without clothing onto a shower chair in the shower being completely uncovered. So we covered her in warm towels and then focused on washing just one part of her body at a time, right? So we have a handheld shower as opposed to the water just coming down on her. We have a handheld shower and we can focus washing on just one part of her body at a time. So maybe just her back to start. And then once that's done, we can kind of rinse and dry, put a towel around her, and then maybe we do some in the front. And then maybe we focus on her legs. But the point here is we're going to try to keep at least some part of her covered at all times. This was one of the most drastic changes I saw in a client. She loved showers. She melted. Once we were able to get her in the shower, adjust all of the components of this appropriately so that she could remain covered and warm, having the handheld shower on her back was like the greatest thing that she could have asked for. So sometimes it's about making these subtle tweaks of using a handheld shower, using more towels. Those are typically not really complex strategies. Most of us can do that at home pretty easily. And they can potentially make a really big difference for someone who's typically very cold or feeling a sense of loss of control, or for someone who is uncomfortable and feeling exposed, right? Many of our clients or family members might not be comfortable being completely nude in front of another person for bathing. So being able to keep them covered, at least parts of their body covered at a time, can be a really great strategy. Okay. Any questions about this case? Feel free to put that in the chat. Right. Okay, and this is the last case example I have. So again, we have a client. This one is a male being cared for primarily by memory care staff. Again, kind of lower 3, so manual action stage. And the description of the behavior, so I was called in because they said he was aggressive and resistant during bathing. So they were saying he was grabbing clothing, grabbing care partners. When they were trying to bathe him, he would keep his arms really tight to his side so staff weren't able to clean his underarms. So a couple different things that we want to note here. It's also very common when clients are at a lower Allen's level 3. So that manual action stage, that repetitive manual action stage, when someone falls on the lower end of that stage, grabbing, it's almost reflexive. So it's very common for individuals to grab. It's very difficult cognitively to release. So these are our family members where when we possibly pull down their pants or help them pull down their pants, their response or reflexive reaction is to grab everything and pull back up, right? Does anyone either have a client or a family member who kind of fits into that stage or criteria where, again, we're assisting them with pulling things down and they just kind of respond or react by grabbing and pulling up? So this is very common at this level. So one, we need to know that so that, again, we're not blaming him. This is very common at this stage. I think it's important. Part of my role here was to make sure that staff understood that this was not him trying to be difficult or necessarily resistance in its true sense. This is more reflexive. So that's an important part of the program or part of the behavior. Other than that, what do you all think could be triggers for this behavior of keeping things tight, keeping things close, not moving his arms? There's a lot of possible triggers here. What do we think? Go ahead and put that in the chat. And while you all are putting ideas in the chat, I'm also seeing a strategy from earlier that you can keep towels safely warm with a couple of hot water bottles nestled between them. I love that idea. What a fantastic idea. Great. All right, so for this client, yes, I'm seeing sense of loss of control. Thank you so much. Absolutely. Sense of loss of control, absolutely a factor, right? Again, also this idea of possibly being confused about what's happening, feeling exposed. So I should also say, oftentimes because of the aggression, they were having 2 or more staff try to assist him with bathing at the same time, right? So they thought, oh, if there's more of us, we're going to help with the aggression. But really what was happening is we're totally overstimulating him. He has 2 people kind of coming at him. He's confused about what he's supposed to be doing. And then they're trying to take all of his clothing off. Again, reflexive. He's pulling everything tight and up and feeling exposed. So we can do a couple of things here. What do we think in terms of strategies? What can we do to try to reduce resistance here?
Someone in the chat on my end is saying, allow this person to do as much as they can on their own and then assist, only then.
Love that. So involving the person in care. Yes, absolutely. So, and somebody else saying in the chat, maybe he could have something to hold. Yes. So I think that this is so important. Yes, at this stage or level, this person definitely does need assistance with bathing because, again, kind of that lower 3 level, he's going to be able to do maybe some back and forth, but mostly he's going to be almost in that level 2 stage of being very sensory oriented. So touching, feeling, holding things. Absolutely, though, we still want to involve him. So yes, we want to give him a washcloth. We want to make sure that the washcloth is nice and warm. For him, we also focused on, we are relaxing the rules here. We are not going to try to do a full shower. If that's too scary, we're going to do a sponge bath, right? We're going to do a sponge bath, allow him to keep his shirt on while we help wash the lower extremities. Once his legs and buttocks and private area are all clean and his feet are clean, we're going to dry him off, get him clean into clean clothes. Then we can take the shirt off and we can sponge bathe the top half. Again, while giving him items to hold and participate. Again, this is another client where I used things like, I'm so sorry. I know this is uncomfortable. And just using those phrases can really help reduce the amount of resistance that someone's experiencing. So I could just say, I was able to wash under his arms, but I would say, oh, I know, I'm sorry, this is uncomfortable, I'll be quick. Just allowing someone to know that you are hearing them, that you understand where they're coming from, that can really make a significant difference. Okay, I'm also seeing some additional things in the chat about, yeah, he's overstimulated. So we're going to reduce how many people are assisting. So one person at a time. Wondering if we could possibly help to gently place his hands in a way so they're assisting, removing a piece of clothing. Yeah, so if there's a way to involve him in some way. Yes, yes, yes. And somebody also saying deflect or redirect, try later. Let him calm down first. Absolutely. If we've come in with two people and he's clearly agitated, we're not going to keep forcing bathing in that moment, right? We're going to have both people leave, give him time to cool down, then have one person calmly come back in. It's also very reasonable to use just talking, reminiscing as a strategy to help reduce agitation. I know I don't have this as a slide as a case example, but I have a client right now who the husband is supporting her with bathing. We were having some difficulty with resistance, and the biggest strategy we used is reminiscing. So they wake up in the morning. I asked the husband to think of a story that brings them both joy, preferably a long-term memory. So something from early on in their relationship, or either something he heard about when she was a child, but I think they met young. So a story about their early days dating. And I want him to wake up, when they both wake up, for him to start to tell this story in lots of detail, because it's bringing her joy. He can also draw this out as long as he needs to. So he starts to tell her this story. While he's telling her this story, he can help calmly get her out of bed. They then calmly walk into the bathroom. He's able to help remove her clothing, all the while reminiscing about a long-term memory that brings her joy. And he's able to go through the whole process to get her into the shower. The only thing that's a hiccup is he said, Rachel, I'm a little tired of hearing myself say the same story every morning. So that's okay, right? We can come up with new stories. We ended up outsourcing to his family, and we said, okay, we're going to send an email to the extended family and the kids and say, please write back with a detailed story about mom in her, when you were kids, so that we can use that. The other thing that you can do is you can have family members leave voice memos, or possibly, little video calls. That would be harder if you're walking and moving, but little voice memos, totally fine. Yes, it can be hard to multitask, so to pay attention to a story while walking, but if it's a story that's bringing joy, that she's heard before, and she doesn't have to attend so clearly to that, it is a really solid redirection technique, or distraction or deflection technique, that allows someone to provide care while also making sure that they're really in a calm, happy place, happy state of mind. Okay. Any questions? Check in the chat. Okay, I'm going to do kind of a little review of the literature. I know I said I would do this, and I think I already touched on many of these concepts, but just want to make sure I go through everything. So we do know from research, when it comes to most of the research about resisting bathing is related to, what they're calling institutional settings. So much of the research about resisting bathing is not specifically conducted in the homes, but we can hopefully generalize a lot of the information and research that's been done. So the research shows us that any of these strategies, they never completely eliminate refusals or resistance. So we're likely not going to get rid of resistance 100% of the time, but we can reduce how often someone refuses or resists bathing. And some of the strategies that can help include music interventions, playing music in the background, music for someone to sing along to. Most music interventions did help. Humming, however, did not the research did not show that to be effective. Didn't necessarily hurt anything, it just didn't help with resistance. Okay, communication triggers, things like elder speak, which again, this is more common in a institution or a facility setting, not as common in the home, but that elder speak, in addition to controlling or negative communication, that was associated with refusing or resisting care. So interventions or strategies that addressed communication style, so the way that we talk about bathing and the way that we communicate to people living with dementia, that had significant results to show a reduction in resisting bathing. I think I mentioned this earlier, there's no evidence to show that aromatherapy reduced refusals. However, again, general research about dementia-related behaviors shows that using a client-centered or person-centered approach is the most effective at reducing behavior. So if you know that your family member really loves one type of, scent like lavender, then by all means, it's worth trying. However, if you know that your family member is really sensitive to certain smells or aromas, then we would want to avoid that. And then adjusting the style of bathing reduces refusals. We talked a lot about that too. So for example, if someone is having a lot of difficulty with actually getting into the shower, it's scary, it's overwhelming, all of the things, too cold, adjusting it to a sponge bath, that can reduce resistance. Okay. All right. So again, general strategies that we have. Oh, what's thermal bathing? That's a really good question. I actually would have to double check that one. As soon as I saw that on my slide, I was trying to refresh my own memory. Thermal bathing, I think, has something to do with, oh, I was going to say that might be a different kind of bathing. Let me double check that for you. Oh, I almost said your name. I'm not going to say your name. Let me double check, and I will include that when I send the slides to Allison, if that's okay with you, Allison. Really good question. Of course, thank you for asking. I appreciate it. So I'm going to review some common strategies. Thank you, Allison. Common strategies for reducing refusal when we think about care partner communication. So I had mentioned this idea of it's okay to use a simple "I'm sorry," but also one of my favorites is saying thank you for your help. Thank you so much. I really appreciate you. Thank you for your help. Simple thank yous go a long way. We can also say things like, "Oh, your hair looks so fresh and clean. Oh, wow, you look so ready for the day." We can just use some simple words of encouragement. We talked a lot about this concept earlier, so I won't go into great detail, but we do want to avoid rationalizing or arguing, avoid rushing. So again, trying to explain to someone that they have not taken a shower in a week, even though they believe that they've taken a shower every day, that's not going to be super helpful. Considering body language and tone of voice, using light touch to calm and reassure. Yes. So I mentioned this idea, light touch can be calming. However, for some people, that light touch may be perceived as painful. They may actually do better with a slightly firmer touch. We call that more like deep pressure, proprioceptive input. So sometimes a slightly firmer touch can actually be more calming than light touch. So we just, again, want to adjust based on what's best for our family member. We want to avoid pulling or holding too firmly. So we don't want to kind of like yank people up to standing or pull them into the shower. That can trigger resistance. Again, we want to think about the words we're using. For some people, even just the word shower will be a trigger. Bathing strategies, common strategies related to task adaptation. Again, we talked about many of these already, but just to kind of summarize, having a bathing routine, including typical time, location, sequence, that can be really helpful. So once we figure out a routine that works, we want to try to stick to that routine as much as possible. We also want to consider limiting additional activities of daily living or ADLs following bathing or before bathing. at least allowing breaks in between. So if we think about oftentimes in the morning, I mentioned this with my one client, but a lot of times what we're doing is we're going right into the bathroom to engage in. Oftentimes it's toileting first, then bathing, then dressing, then oral hygiene, and then breakfast. That's a lot of times what a sequence looks like for a lot of people. That's a lot of back to back to back to back activity, right? So especially if there's resistance involved, we want to try to provide more breaks throughout that sequence. We don't necessarily need to do them all back to back, or we want to consider, are they hungry? And is that part of their agitation and resistance? So should we focus on breakfast first, provide time to relax, and then do a bath? Maybe we're going to do a bath or shower later in the day, because that's when, they're not as overwhelmed with the morning care routine and we've had time to relax. Again, client-centered, person-specific. So we'll make our adjustments based on what works best for them and for us. Making sure we have plenty of time for bathing. So again, trying not to rush it. I mentioned this idea of placing towels or clothing in the dryer ahead of time. Somebody had brought up this idea of keeping these towels or clothing heated with hot water bottles, which I love. Some people even have, heated towel racks, which is great as well. Other people mentioned, this idea of wearing towels or wearing robes into the shower. Handing the washcloth. A lot of you mentioned this for that last case example. Allowing the person living with dementia to participate in whatever way they're able to. So for anyone at that manual action stage, okay, yes, they're not goal directed, so they'll need some assistance with bathing, but they can still participate by washing their arm, right? Holding the washcloth in their hand, even washing their face with the washcloth. Simple components of bathing they can still engage in, and we want to involve them whenever possible. Again, we want to do this without overwhelming them too, right? So we want to kind of break it down. We're not going to cue them, okay, wash your arm, now wash your other arm, now wash your leg, now wash behind you, now wash your face. That's going to be too much. But if we break it down and just have them wash one part of them, and then we give them a little break while we wash another part, and then have them maybe wash their leg, and then a little break while we wash the other leg. So there are ways that we can break this down so that they can participate, but we're not totally overwhelming them. And then using a handheld shower whenever possible. So again, we talked about this concept of this could be painful, it could be scary. There's a lot of things going on with an overhead shower head. Also, we as caregivers have a lot less control over what's happening with the water if it's coming from the shower head. So when we have a handheld shower, it's a lot easier for us to control. If they're feeling overstimulated, we just point the water away. We can put it on the ground, right? We can aim that water just at their legs for a part of the shower or just at their back. So it gives us a lot more control and allows them to feel more comfortable. And then environmental adaptation. Again, you all talked a lot about this in the chat. So we did mention briefly, but only having items needed for bathing. So I talked about having the bathroom still feel homey, but on the other end, we don't want it to be so cluttered or overwhelming that we can't focus on what we need to do. Keeping the bathroom warm and comfortable. We talked a lot about that. Limiting visual and auditory distractions. So again, we might decide that having music is actually a really positive way of engaging our family member in bathing. But if we do that, we don't want to be providing a ton of verbal cues or words over the music while having the radio on in the background, right? If it's too many auditory or sound cues, it's going to be really hard for the person with dementia to focus. If someone with dementia has a fear of falling or they're at risk for falls, we do want to consider adaptive equipment. So things like grab bars, things like shower chairs. Again, if we think about matching cognitive level to someone's function at a level 3, we talked about that manual action stage. People are going to engage with what they can see. This really impacts kind of where we place grab bars and where we set up shower chairs, because it's more likely that they'll interact with them if they're directly within their visual field. So again, I know that's kind of a tricky conversation, but you can always, email me and I'd be happy to give you some specific recommendations there, or connect you with, an occupational therapist who could help you make specific adjustments to equipment based on your needs and your family member. Also, adjusting lighting. We chatted in the beginning how if the room's really dark or the shower stall is really dark, that might be triggering fear. So making sure that there's appropriate lighting can be helpful. I've truthfully never used this particular strategy, but I figured I would mention it since it does come up in much of the literature. This idea of sometimes adding blue dye to the water to help increase contrast. Again, I've never been one that has tried that, but I wanted to just throw it out there. If you have tried it, please put it in the chat because I'd love to know what you thought about it. And then drawing attention to the bathroom door. So if someone is higher level, goal directed, they're in that 4 range, we want to allow them to participate as much as possible. They're still goal directed. If we draw attention to the bathroom door by putting a picture of a bathtub or a shower on the door, it might be more likely that they're going to locate the bathroom and go in. Something that I have not talked about today yet, but I do want to mention because it has come up with some of my clients, is also this is particularly true of people with more moderate to severe dementia, the way that we as care partners are presenting ourselves. So sometimes people living with dementia are more receptive to having a medical professional support them with bathing. So if that's the case, if you don't have a medical professional don't have a home health aide, sometimes I suggest that family members consider getting a pair of scrubs for themselves. You wear the scrubs in to support the person during bathing. This is a more medical healthcare role. You wear those scrubs just to support them during maybe toileting and bathing. And once that's over, you change back into your other clothes. I also kept this in mind for some of my clients. Many of my clients, if I was supporting them during bathing, I made sure I wore my scrubs that day. Some of my clients, however, were the opposite. If I wore scrubs, they were like, no, that was a trigger. So we want to be really thoughtful about what each person would prefer, but just something that you might consider. And then again, we mentioned this idea of music. You could absolutely consider something like singing, playing music in the background. And then something else that I haven't talked about yet, but we do know from the literature can help, this idea of having repetitive activity, repetitive motion to soothe the nervous system before or after resisted activity. So what do I mean by this? This could be something as simple as like a nice little hand massage, rubbing someone's back. If someone has a safe rocking chair, doing some rocking, some soothing rocking motions before or after the activity. So these are strategies that can actually help soothe the central nervous system, which could, in theory, reduce agitation and reduce resistance. So it's something that we can try before and or after something like resisting bathing.